Hi, and welcome to discussion number 4 out of 6 for Wellness Wednesday. Today we will be discussing vision and hearing. My name is Morgan. I am part of Healthy Aging Association. I contribute to Wellness Wednesdays, to the Aging in Place Dignity at Home program, and then our Green Bag program as well. And we're joined today by Billie Scott. Some of you may know her, especially if you've been longtime participants. So, Billie, I would love if you could introduce yourself.
So my name is Billie Scott, and I work at Central Valley Hearing Aid Healthcare. I've been here for a little bit over 3 years, and I'm a hearing aid specialist. And prior to working here, I was at Bethel Retirement for 22 years and have been in the senior industry since I was 18. So it's about 30 years now, a little over 30 years actually. I'm currently the president of the Stanislaus Senior Foundation as well. That's why you see how it says, I think it says foundation on my name there. And so we're here today just to give some information. I do senior advocacy, and I work pretty closely with Healthy Aging and with Area Agency on Aging as well. So it's nice to meet all of you. Hi, Carol.
It's great to have you here, Billie. Thank you. Okay, we'll get into the overview for vision. We'll briefly touch on vision today. I really want to put a spotlight on Billie and hearing. So let's get into our presentation. I wanted to, before we begin, I wanted to highlight that the National Council on Aging, it reminds us that while slight changes in vision are naturally occurring, sudden or slow changes in eyesight are not solely attributed to aging. So it's a good reminder, right? We shouldn't just assume that as we begin aging, we'll lose vision or we'll lose hearing, right? Some of these things are definitely preventable or can be treated. There are many reasons why vision can get worse, and most of them can be prevented. So, a couple of chronic eye conditions that I put on the screen today are glaucoma, diabetic retinopathy, macular degeneration. But because it's the most common with age-related decline in vision, I wanted to highlight cataracts today. So again, we'll briefly touch on cataracts toward the end of my presentation here. As with everything else, vision changes are highly complex with several different causes. I don't want to just list all of the causes for you today. For example, in the nutrition section, which we'll get to in a minute, I really wanted to provide you all with some great recommendations that I learned during nutrition courses and my certification processing. And so we'll give some solutions as well to a couple of the things. Chronic conditions. Dr. Robert Chin, I believe it was back in June, really touched on chronic conditions with us. It was session number 2, if you remember. And he highlighted that chronic conditions also increase the risk for vision problems, right? So some of the chronic conditions that may impair vision include heart disease, stroke, diabetes, high cholesterol, hypertension, kidney disease. The list can go on. But these are really serious conditions, and we want to be vigilant about them because, yes, they can cause poor eyesight, but they can even lead to blindness if they're not treated. That's something that can certainly contribute to vision issues. Another thing is injuries and falls. Wellness Wednesdays are really intended to prevent falls. But if you've already experienced a fall, it's important to know that falls can definitely cause some vision problems, especially if there's an injury to the brain tissue or to the eyes directly. And this is because the brain and the eyes connect through these neural pathways. And if that gets damaged, it's responsible for vision loss. And the tricky part about this is poor vision can also lead to more falls. It becomes a really difficult cycle that we want to avoid and can avoid, especially when it comes to fall prevention. Most of these vision changes that we talk about can be prevented or treated, which is great. Moving on to nutrition. I encourage you to reach out to your doctor before adding or taking away a food from your diet. This is not meant to be a diet plan. It's just a recommendation for these specific antioxidants. Okay, so our eyes need specific vitamins, minerals, and nutrients to stay healthy, to maintain function. Not consuming enough of vitamin A, vitamin C, and zinc can really gradually reduce our vision, especially as we age. The commonalities between vitamin A, vitamin C, and zinc is that they're all antioxidants. We've all heard that word, antioxidant. Oh, it's great. It has antioxidants in it. Well, what does that mean, and how does that affect nutrition and eyesight? Antioxidants their role is to protect cells from oxidative stress. And that oxidative stress can really increase the risk for macular and retinal degeneration, as well as cataracts. The function of vitamin A is to protect the retina from damage. And I've listed a few sources for you of where you can actually get that vitamin A in when considering diet. So sources of vitamin A include cheese, eggs, milk. There's kind of a pattern here. Greek yogurt, so your dairy products, and salmon, actually. The role of vitamin C is that it improves immune function. We know that, but it also maintains collagen and keeps your blood vessels healthy inside the eye. So it really aids with those capillaries, really tiny blood vessels. And so you'll really want to get great sources of vitamin C. Those include citrus fruits, melons, strawberries, and you can even find it in fortified cereal. Lastly, zinc, the last antioxidant we'll talk about today. The function of zinc is to support immune function, cell structure. So it provides that structure to our cells so we're not floating around like amoebas. And it assists with the transport and absorption of other nutrients. It's a very, very important mineral. The sources that you can find zinc in include meat, shellfish, dairy products, and once again, fortified cereals. Lastly, a contributing factor to declining vision as we age, or just in general, is a big mishap when we skip our regular eye exams. Seeing your eye doctor annually, once a year, can really help catch small changes early, and that's super important. We want to make sure that it can even spot other conditions that could be contributing to poor vision. So it can catch things like diabetes or high blood pressure in relation to decreasing vision. Okay. Lastly, today, before I turn it over to Billie, I wanted to touch on cataracts and fall risks. So, according to the National Eye Institute, I've listed a few symptoms that are linked to cataracts. And what I've done today is, yes, we'll go over the symptoms, definitely, but I've also created a little scenario to, hey, how is this a fall risk though? What should I watch out for? Why is this important? So the first symptom that is most notable in cataracts is blurred or cloudy eyesight. It's really it's difficult to notice obstacles in your path when you have that blurred eyesight. So imagine you're walking outside and there's a big crack in the pavement that you miss. If you stumble because you missed that crack due to the blurred eyesight, the blurred eyesight can also make you very unsure of where to step next. The second symptom is muted or unsaturated, so really dull colors. Say you are walking up the stairs, and when colors are really muted and unsaturated, it could definitely impact your depth perception too. If you can't differentiate between those two colors, you can miss a step while you're walking up the stairs, stumble, and have a fall. And those muted or unsaturated colors can have a big impact on how you're able to navigate those steps and differentiate between different colors. The third symptom we have that are really common in cataracts include like little halos or light rings. You know, when you stare up at a light bulb too long and you get that little halo in your eyeball, that happens, but constantly when we're looking at headlights or street lights, right? So that's a common symptom. And this can be a fall risk. This is a scenario I gave. You're walking out of a restaurant to your to your car at night. The street lights are really bright and they're creating halos or rings that disrupt your vision in your eye. So in this case, it could be possible that you're trying to get to your car from this restaurant and your eyesight is so impacted that you could miss a curb, right? Because you just don't notice it. And then obviously when you miss a curb, it'll lead to an unexpected fall. And then lastly, frequent changes in prescription lenses. It definitely takes time to adjust to a new prescription. And if you're having to change that constantly, you might be experiencing temporary dizziness or that off balance feeling. Frequent changing in prescription lenses, the symptom of cataracts, could cause a fall, which is why we really need to focus on getting into those eye exams. Okay, Billie, whenever you're ready, we'd be happy to hear what you're going to talk about today.
Okay, well, you all already know me, so I just thought I'd pop on here, and we want to make sure that you know your wealth. Everyone knows their wealth in different areas, correct? So we want to make sure you know it in your hearing health as well, making it part of your annual physical. Oh. You can move the slide. So we want to not only protect your hearing, but protect your independence. Being able to hear what's going on around you, making sure that you're able to understand situations, not only for enjoyment, but also for safety. That's a big one for us, and being able to protect your ears. And we're going to talk about that today, and also about protecting your independence. Okay, move the slide. And why does hearing health matter to us? Well, hearing connects us with the world. It connects us with other people, and it helps us to understand what's going on around us. It's a main way for us to communicate with others. And what? Hello? That was a mistake.
I think so. Naomi, do you want to mute your microphone for us, please?
I like to see everyone, so I'm going to come back to gallery view. I like to see wonderful faces. I've got my slides here, so I'll let you know if and then just let me know if we're on the wrong slide.
Perfect.
So one of the things is what can happen when we have hearing loss that goes untreated. There's quite a few different things. Obviously, you would lose some of your independence. You would rely on other people to translate the conversation. Maybe you'll have to use a pen and paper. You're also going to lose some independence, having to require, you can't make that phone call and hear someone clearly. You wouldn't be able to have a conversation and maybe in a restaurant, in a loud environment. So it definitely puts a damper on your independence. And then your activities. We find that individuals who have a hearing loss that are not treating it and they are just going without devices or without knowing their hearing health, that they might just find themselves become more recluse. They're not attending events.
Oh,
Get something, but they're not actually in the conversation. I don't know if anyone else has experienced that. I know that I have a dear friend that she can't hear, and if she's sitting in the wrong spot, you can see it on her face where she'll gradually say yes to something, and she might say yes to something you don't want to say yes to. So you not knowing your hearing health, and maybe you are now volunteering for something you didn't want to. So you want to make sure that you don't find yourself removing yourself from the conversation, removing yourself from the group, even when you're there physically, but not hearing them could also cause a concern for you. Go ahead and switch slides. And that's why it's important for your annual hearing exams. How many of you have had an annual hearing exam? That's great. I have as well. So that brings me, what age do you think you should start having your annual hearing exam? I like to be interactive. So there is no exact age. If you are struggling, if you're finding yourself not hearing things correctly, if you're finding that others maybe sound like they're muffled and you're having to ask others to repeat themselves, or maybe somebody else brings it to your attention. Those are some of your big points of why you should get a hearing exam. If you do a referral from your doctor, we can bill the insurance, meaning your insurance has that as part of your preventative plan. It doesn't mean just because you get a hearing test that you're going to have hearing aids. It's important to know that well, know where you're at, how are your hearing levels, what might you be missing or what you're not missing. Some people come into our office and they have a hearing test and they have normal hearing, and then they come back in 2 to 3 years and have another test. If you're somebody who wears hearing devices or you struggle with hearing, it's important to have that annual hearing exam because early detection is key. So maybe not everyone knows this, but we hear with our brain, not our ears. So the more that the sound does not get to your brain, the harder and harder your brain will struggle to understand those sounds. So if you're not hearing things clearly, it is best to aid your ear to get that sound to the brain. It also helps maintain your cognitive health. If that sound is getting to the brain, you're not missing those conversations. You're not missing, did she ask me if I took out the trash? And you might want to know why she wants your cash. So it's as simple as that, where you're missing the words.
Yeah, that's my issue. I gotta get some hearing aids.
Hearing and understanding are two different things. So yes, they go hand in hand, but they are definitely two different things. Like we talked before, it also prevents social isolation. You won't find yourself avoiding conversations or avoiding events. I hear a lot of people say, well, I just don't go anymore because I can't hear them, or I can't be part of the conversation. So we find that individuals are not attending their events, finding themselves spending more and more time alone at home instead of with their loved ones. It also helps monitor your overall wellness. As that old saying, it's all connected, right? The hip bone's connected to the knee bone, or the knee bone's connected to the thigh bone, wherever it goes.
You don't irritate
Irritate
people by constantly saying what?
Right, yeah.
What?
Some of the things that you want that your hearing health can go hand in hand with other situations of your health and your wellness. So bringing that, you should really think of an annual hearing exam the same way that you think of a mammogram or an eye exam. or you go to the dentist's office. Those are all things that you do on a regular basis. So hearing should be just that. Go ahead and switch slides. So when we talk about hearing and cognitive health, we talked a little bit about how you might be missing certain letters. So if you've ever opened up a book, I want you to imagine, and I want you to erase every fifth TH and every fifth S, every other D, and I want you to try to read the paragraph and understand what they're saying. For those individuals who have less than optimal understanding, this is how they're hearing. So when you're reading something and certain things are missing and you're trying to figure them out, this is how individuals would be hearing when they have poor understanding. When you look at something, when we're talking to someone, especially if it's a loud environment or it's not clear, individuals could be struggling without you even knowing. If we don't get that sound to the brain and the brain struggles, the more and more it struggles, the more and more it will start to no longer understand certain sounds. And that is why it's proven that for memory decline, dementia, it is linked to those. You're getting isolation, you're not going out as much, you're not communicating as much, and what comes into play at that time is if you don't use it, you lose it. So by not getting that sound to the brain, your understanding can deplete over years. And a hearing aid for those, if you wait too long, so early detection is key. Because if you wait too long, a hearing aid is just that. It's an aid. It will aid what you have. So if you only have 80% understanding, a hearing aid is going to aid 80% understanding. Because a hearing aid does not bring back your understanding. It amplifies and it aids what you have. And that is why early detection is key. By aiding your ears early, when you're first starting to feel that discomfort in the conversation, the idea that you have to ask somebody to repeat themselves, by early detection and getting that sound to your brain is how you protect that understanding. And that is key to keeping your brain active and to help with the concerns that come with cognitive loss. The next slide. And how do you prevent further hearing loss? Well, of course, if you go to a concert that's really loud, maybe you mow the lawn, you want to cover your ears. If you're a woodworker, we have individuals who are woodworkers. If you're in a loud environment, making sure that you are protecting your ears from any further damage. Even if you have a hearing loss already, protecting your ears from further damage is still as important as doing it when we were younger. When you utilize that, it helps manage your medical conditions as well. By keeping that hearing health in a positive setting, knowing where you're at, knowing how to treat it, or simply monitor it. Not every person that comes into our office is here to get hearing aids. We sometimes do hearing exams for someone who might be starting a new medication or a treatment plan that could cause concerns with their hearing. So the doctors want them to have a test prior and during and after those medications and or treatments. We have individuals that might come in here. They might be going to take a test or get a job, and they want that hearing health, and they have to have that knowledge in that test. Some people, they simply are making it part of their annual physical. They don't have any concerns quite yet, and they're getting their doctor to send that referral over the same as they would get their annual blood work. They're coming in, they're getting an idea of where their hearing health is, so they have a better understanding of what their body is doing and how they're hearing in situations. Most hearing exams, if you're going for an actual exam, these things can be detected very early. There's lots of different ways you can get a hearing exam. One of the best ways for us that we find is most of our patients come in from a doctor referral. By getting that doctor's referral, we're able to, one, communicate back with your doctor. We give a full report, including everything that we spoke about and the history prior to you coming to us. That all goes back to your doctor. That hearing exam can determine whether you have good hearing, whether you have in need of hearing aids for communication, whether you need to see an ear, nose, and throat specialist. So those are all things of why people would come to us. Some people come just to know where they're at, and they want to monitor it. So that's an important step to take when they come in. And early detection, again, is key. We're also going to be doing, for those of you who attend the summit, we will be doing the screenings there as well. And that is a quick screening that's done by our audiologist. And she'll be able to kind of give you a broad idea of where your hearing health is and give you information on how you can choose to move forward or talk to your doctor after that. Want to go ahead and move forward. One of the big things too is if you came in for a hearing exam or you got a hearing exam anywhere, most people also do loaners, so you can get an idea of what you're missing. And you may not know. On the hearing exam, we'll be able to let you know what letters you're missing, what frequencies you're missing, maybe even the chirping of birds. I had a gal the other day, she came back in and she said, I had no idea that my blinker was so loud in my car. And the little things, or that the button in her, when she turned her light on and off, she said, I didn't even know that it clicked. So in our world, there's a lot of sounds that we might possibly be missing that you definitely, maybe you don't want to hear them, but while you're missing those sounds, you're also missing those clear words, maybe from your grandchild or your loved one, or in that restaurant setting, or at a service that you go to. There's lots of places where you could be missing out on that. And to be able to rediscover that joy and hear those things, again, you would be surprised at what you're missing. So I think that's also important to notice, find out where those gaps are, find out where your hearing health is. That's probably the most important. Again, I'm going to say it again, early detection is key. It also brings you better relationships. How many that might be missing a conversation, you might find yourself isolated, or if someone comes over to visit, your conversation is now very limited because you know that they can't hear you. And it might not just be on the person who has the hearing impairment or someone who's hard of hearing. It could be on the other side. They might say, well, I'm just not going to say it to them because I know they can't hear me. So I think it's important to make sure, because it definitely makes your connections, your relationships, it's going to make them stronger because you're not going to feel as frustrated when having those conversations. And most importantly, you're going to have the conversation because you can hear them nice and clear now. You'll definitely have less frustration with your family and friends as well. So improving your hearing health experience. I switched slides. Are you on the one with the red hearing aids?
We're good.
That's a new color that came out this year. I thought that was fun to put on there.
Yeah.
For those of you who might already wear hearing devices, if you're thinking that they might be these big, giant, clunky items on the backs of your ears, or they might fill up the whole entire ear, there are so many different types of hearing devices. It's really hard for me to see one person and say, this is what you would need. The process is you need the hearing exam first so we can see what would best fit your hearing loss. They are very small now. Sometimes there are still a few bigger ones, depending on the hearing loss. Those are for more profound hearing losses. But they're actually smaller, and they're smarter, and they're sleeker than they've ever been. They're Bluetooth, they're rechargeable, they hook up to your phone, and just recently they have what's called AuraCast in them, which is now going to be a Bluetooth type system that is going to stream through places such as opera halls, airports, movie theaters. these hearing aids will now, you'll be able to go into one of these places and stream it directly into your ear and be able to enjoy it at the level that you need at the same place somebody might be able to just listen to it from the regular speaker. There also, it helps you with staying active, making sure that you are out there doing things. It also helps with your balance. You know, we have two ears for a reason. So you have that balance coming in. If you have somebody who definitely has one side that is worse than the other, by having hearing aids, say you're here, you're able to bring them up together, be at that same level, helping you with falls and balance concerns as well. We have that equilibrium in our ear, and so by not feeling balanced with those two ears, it could cause concerns with falls and balance. So by having those hearing aids and wearing them on a regular basis, that would help you with those concerns as well. It also helps you with your small community groups and resources, being able to be in those spaces, understand what is offered to you, understand the setting that you're in as well. So making sure that you're having that experience with those hearing aids. If you are somebody who wears hearing aids, regardless of where you've gotten them, make sure you continue your plan of care with them or with someone else who understands hearing aids. By putting the hearing aids on and just wearing them every day and not doing any maintenance or follow-up, you may be also doing yourself a disservice. An annual hearing exam can help those hearing aids be adjusted to any new thresholds that you might have. Having them cleaned and checked on a regular basis will also help them. If they're clogged, they might not sound like they're working. So there's lots of reasons why you want to continue that care and keep that healthy lifestyle with those hearing aids if that is something you choose or that your hearing health requires. Next slide. So what would be the next step? Obviously, would be to schedule your hearing exam. Or if you're leery of that, stop by the summit, check us out, see, ask those questions. Our audiologist will be on site that day. We will have, our practice has 7 providers, an audiologist, and we have an audiologist student with us as well right now. We are the only hearing aid location in Central Valley that has an audiologist on staff. So that makes it a little bit better, just giving us that individual who can do those diagnostics and give some input as well. Take steps to protect your hearing. If you're out mowing the lawn or you go to a loud concert, you can still hear the concert if you put in the foam inserts. I do it all the time. So something to help you, and just make sure if you're in a loud environment, take breaks from that. Turn the volume down if you can. Those are things that can help you protect that hearing. And be open with your loved ones. Be honest about if you're struggling, be honest. Because the way you communicate with someone is extremely important. And if you're honest with them and you let them know, I need you to come in here and see my face before you ask the question. If you're with somebody who has hearing concerns, if you find that they don't hear on a regular basis, they can't hear what you're hearing, by touching them on the shoulder and simply letting them know that you're starting the conversation prior to just coming into the room and speaking to them from behind, your chances of your communication being better are 100%. Having that face-to-face communication is really going to help someone who is already hard of hearing. Also, making sure you slow your speech. If you're talking to someone and you're speaking super fast, they are probably still concentrating on the first sentence you said. And remember, they're reading. If they have poor understanding, they're reading and they're missing half of the information you're giving them. So they're trying to pick out what the sentence is by just the context of the sentence. Okay, go ahead and scroll up. So a healthier, happier means healthier, happier you. If you're able to hear, you're going to be able to hear that funny joke or your grandchild laugh or the birds chirping outside. You might be amazed at what you're missing. And so by being in more present, hearing what's around you, knowing your hearing health, you're going to be a happier individual. You're going to be part of groups. You won't find yourself isolating as much. And that's important. That's so not only will it help you hear, will hearing aid or knowing your hearing health help you hear, it's definitely going to help you be part of your community and part of your family. We put on here questions. I also have that for those of you who don't know us, we have 3 locations at Central Valley Hearing. We are in Atwater, Turlock, and here in Modesto. That's where I'm at today. And we are a small business owned by 2 sisters, Cindy and Monica. And they have been in business. They just celebrated their 5-year anniversary this month. So they've been in business now for 5 years. They have I think we have a combined 40 years of service in the hearing industry, though. Prior to them opening their company, Monica worked for an audiologist for 15 years. So does anyone have any questions about our services or about your hearing health?
Where do you put your hand up for here?
We can
No.
hear you, Naomi.
Oh,
Hi.
okay.
Mhm.
I have a question about hearing protection. In the kitchen, I have a Vitamix, I have all these machines. And I use these little foam earplugs, but they're always falling out. Is there a better way to try to block those noises? Or
Well, the foam inserts work well. They also have ear muffs you can put over. Those are a little bit more cumbersome. But if your earplugs, if they're continuing to fall out, you may need a smaller size. Maybe your ear canal is smaller. And you can also pinch them really, really tight before you put them. You might be able to see if you could find a smaller size. Maybe.
And so if you're using hearing aids, then what do you do? Because I've had my hearing tests and I'm supposed to get some, but then what do you do when you're wearing your hearing aids?
So a hearing aid will not amplify over a certain level. So they're not going to hurt your ears. So if you have a hearing aid that is at a certain level and you're in a loud space, it will not amplify over a certain level. It'll actually compress and turn off. So you will not hear that. It will not amplify over at an unsafe level.
Well, so will it lower the volume?
No, it will not lower the sound, but if you're in a different area and you want to lower the hearing aid, you can turn the volume of the hearing aid down, or you can simply turn the hearing aid off.
Oh, okay.
And you can do that from buttons on the back of the hearing aid, or you can do that by an app on your phone, whichever one is more comfortable for you.
Okay. Thank you.
Thanks, Naomi. Anyone have more questions for Billie?
I have a question about the zinc.
Yeah.
Now, I was taking zinc when COVID was going on because they recommended that, but my doctor afterwards said that I could quit taking that because right now there's not a problem. How much zinc is a good amount to be taking?
Oh, I don't remember the exact dosing, so I don't want to give you an incorrect answer here. A great resource to find that would be CDC, and I'm happy to look that up for you and give you the correct figure on that. But Did he mention that you were getting too much zinc in your diet? Because zinc and copper are best buddies, but you have to be careful about balancing them out because they're really like a frenemy here. So you need to be careful with the zinc intake because that can lower the efficiency in which copper is absorbed into the body. Did he mention that you were getting too much or too little, or just that?
No, it's
No.
just I took a supplement, and he said because of the COVID and everything, he said that I probably didn't need that anymore. But
I see.
with the hearing issues that I have, I'm concerned that maybe I don't get enough in my diet.
Right. So you can always request for that type of testing from your primary care physician. I definitely recommend reaching out to him if you feel some symptoms that come along with low zinc. For the meantime, it might be a good idea to get these nutrients through your food.
Thank you.
Regardless to say, I really recommend you talk to your physician about this and make sure that you are getting those right zinc levels.
Thank you.
Good question, Coral. Thank you. Anyone else?
Thank you for explaining the brain activity with hearing.
Mhm.
That was very informative. Thank you.
That was great, Billie. Thank you. And I don't know if you all have noticed this pattern with these Wellness Wednesday session, how these topics interconnect into every area in your life. For example, hearing. If you're low on hearing, as Billie, if the hearing has decreased, as Billie mentioned today, you can experience that social withdrawal. The social withdrawal leads to more physical inactivity. Physical inactivity leads to health issues, right? Such as chronic conditions. They're really all tied together. It's really important to comprehensively take care of your body. And so there is a trend every month that we have with these Wellness Wednesdays. And I'm really glad that Billie did a great job highlighting all of these factors that go into well-being and go into successful aging. So again, thank you, Billie. That was wonderful. If you are interested in meeting Billie in person or even participating in the hearing screening, we're going to have vision screening too at the Healthy Aging Association Fall Summit. And mark your calendars. That is going to be on October 10th. It's going to be a Friday. It falls in the fall prevention month, and it will be fall time too. So seasons are changing here. Speaking of season changes, we're going to be diving into osteoporosis next session. And I'm sure Dr. Robert Chin, who has already come on before, will highlight a little bit of osteoarthritis. And if you experience that, you know that when those seasons change, your osteoarthritis can really start acting up and bothering your joints, your body, what have you, causing pain. So that will be a great session for you to attend. It will be on the 24th of September. I can't believe we're almost close to Christmas. I'm ready to get my Christmas tree out. It's going to drive my mom crazy. Anyway, thank you all for coming on and watching today. Again, I've made a mental note. I will send you that video that wasn't able to display audio during the presentation today. And if you need any resources, if you're interested in the Fall Summit, or if you're interested in our Matter of Balance fall prevention class, give our office a call, or you can email us here at healthy.aging2000. All right, everyone. These are my references in case you want to look up anything. And that's all I have for you today.